Now we're going to be showing you how to do a proper interrupted suture, horizontal mattress, and vertical mattress suture. I've taken the time along this incision to draw some little dots. These dots are approximately 5 millimeters or a half a centimeter from the middle of the incision line here. They are also a unique distance of approximately 1 centimeter from each other. It's important to remember that when you're doing either interrupted sutures or horizontal mattress, that you are approximately taking your first bite a half of centimeter or 5 millimeters from the incision itself, coming out on the opposite side as a mirrored stitch. When you are moving over, how far do you move over from one stitch to the next? Well, you have a range of anywhere from about a half a centimeter to 1 centimeter, but these are approximately 1 centimeter, which would be good for this type of incision to close up. So after you've properly loaded your needle, like we've talked about before, approximately 2/3 the distance back from the tip of the needle, the next thing to remember is your needle must enter the skin at approximately a 90-degree angle. So you need to pronate your hand, and I'll try to put this in the needle in the picture as best as I can here. So you can see it's entering the skin at a 90-degree angle, about a half a centimeter away. I'm going to use my skin forceps to stabilize it. You can take this in either 1 or 2 bites if needed. You can use your skin forceps to help you reload. And after you've taken 1 bite, then you're going to be doing the same exact thing on the opposite side, going in at the same distance and coming out approximately a half a centimeter away from there. Now, after you've pulled your needle all the way through, you're going to do a proper instrument tie. To do so, you need to remember to place your instrument, in this case your needle forceps, right in the middle between, and I'll try to zoom out a little bit here so you can see it better, right at over the incision at the halfway point between these 2 strings. You're going to be taking the suture that has the needle attached to it, and you're going to be wrapping it once around and 2 times around. After you've done that, you can open up your needle forceps slightly, grab the other end of the suture, and pull that through. That would be known as the first throw. After that, you are again going to put your needle holder right over the incision, and you're going to take the longer string where the needle is still attached, and now you only need to wrap it around once. You're going to grab the end of the other suture and pull it in the opposite direction. That makes a nice square knot, and that equals 1 knot. So 2 passes or 2 half throws equals 1 knot. I'm going to repeat that again, but the second time I only need to wrap it around once. Grab the other end. You can see the other end is pointing north, so when I grab it, I'm going to pull it to the south direction. And when I'm done there, open it up, put it over, wrap it around once, grab it at that south direction, and pull it to the north direction. After you've done that, I now have 2 complete knots, and I'll zoom in so you can see. When you're done with that, you're going to be grabbing both strings, pulling up on these, and when you've done that, you will use your scissors to go down on the knot approximately 3 to 5 millimeters away. You're going to turn it at a 45-degree angle and cut. So now we've done 1 interrupted, and in this situation you can see the knot is more on the south side of the incision, so when we repeat this, we're going to try to keep that the same. I'm going to reload my needle, and we're going to do another interrupted. So as you can see, I'm going to start about a centimeter away, pronating my hand to get a 90-degree angle start. Okay, I'm going to get it at the halfway point through it, reload it, and then I will do the opposite mirrored image on the other side. Okay, I'm going to leave a little bit of a shorter tail here so I'm not wasting very much suture. And I'm going to repeat the process of doing the surgeon's knot. Surgeon's knot is when you wrap it around twice the first time. You grab the other string, and I'm going to pull it to the opposite side. Then very gently, I'm going to put that in the center, wrap it around once, grab this string, the suture that's on the south, pull it to the north. That is one knot. I'm going to repeat the motion, but I'm only going to wrap it around one time. And the last one to complete the knot, to make 2 square knots. Okay. I'm going to lift up on both of the suture that you see here and leaving a tail of